Throughout the United States and across the world, we are seeing significant increases in people experiencing sleep apnea. There are many myths as well as real beliefs, and so I want to spend a few minutes for today's Wellbeing Wednesday talking about the important topic of sleep apnea. When most people are talking about it, they're referring to obstructive sleep apnea, where we are seeing that the airway becomes blocked or collapses while someone is sleeping. It's reducing the ability for air to get through, hence the obstruction. Many people experience snoring and any other sounds that we may hear. Some people will wake up gasping for breath because in order to get a sleep apnea diagnosis, there are many times where people will have instances where they stop breathing for up to 10 seconds at a time. You'll hear individuals referring to an AHI, an apnea-hypopnea index. And while yes, some people completely stop breathing, we also see other individuals that their oxygen levels, their O2 saturation levels will also be significantly dropping. So somebody may not completely stop breathing, but they're getting significantly less oxygen. The body is having to work harder to get that oxygen. There is also CSA, centralized sleep apnea, which is more a function of what's happening in the brain when somebody stops breathing during sleep, and complex sleep apnea, where we see a combination of OSA and CSA. For many people, the biggest reason that they don't want to get a sleep study, other than not wanting to go into the clinic or sleep in a lab, people don't want to always spend the money for those tests. And there are now home-based sleep studies and other options that you can do to really get a better sense of what's happening for your health and for your body. But many people don't want to wear the CPAP machine. And while we know that that is a gold standard and has been shown to be one of the most effective treatments for sleep apnea, there are additional resources that you can look into. For instance, working with a dentist that's been boarded through the American Academy of Dental Sleep Medicine. If the sleep apnea is more mild, some individuals may be able to wear a dental appliance or do other types of laser treatments. Some people will go work with a maxillofacial surgeon to be able to open up the deviated septum, collapsed valves, removal of adenoids and tonsils. There can be many different things, even looking at the palate and how tight it is in the mouth, or along uvula, floppy phalangeal tissue. There are many other alternatives other than just not doing anything. So as a quick test for yourself, there can be many warning signs to see that you may potentially have sleep apnea. And we can see longer periods of daytime sleepiness, waking up with a headache, for instance, that will then go away, dry mouth. A lot of that daytime sleepiness, as I mentioned, many people will wake up multiple times throughout the night and think that it's because their bladder is waking them up, but it may be that their body is waking them up to breathe, and then they realize that they have to use the restroom. We can see mood changes, also differences for individuals with memory and concentration, because many times a lot of these sleep apnea episodes will occur during REM sleep when the muscles go into that paralysis to protect us from moving during dreaming, but then we see more obstruction and pressure on the airway. So there are many different disruptions for our brain health as well as our heart health that we want to be thinking about. So if you or a loved one may potentially have sleep apnea, I want to encourage you to at least start having the conversation with your providers, consider a sleep study, and many of the alternatives versus just ignoring it. Be well.